But asking and encouraging children to adopt healthy lifestyles, including physical activity outdoors, is just not enough. The Surgeon General highlights the importance of making policy and environmental changes to support children's health. And we must remember, and this is very important, adults serve as powerful role models for children. If children see adults eating nutritious foods and enjoying physical activity outdoors, they're more likely to do the same. Without those role models, they're not likely to do it. Your commitment to the health of our environment and that of our nation's children are perfectly aligned with the Surgeon General's vision. Collectively, as a nation, we must find and promote ways to de-emphasize current indoor activities that promote sedentary lifestyles, such as screen time, and increase opportunities to be active, preferably outside. This latter effort will require ensuring safe, clean, and abundant areas in which children can play and explore.
I'm not downgrading the value of medicine. As a doctor, I know that medicine can be very, very helpful, but we have many ways, and we know that deep breathing exercises can reduce your blood pressure. We know that activities outside, working, moving, being out there will help secrete the natural painkillers in the body, endorphins, even serotonin, which we find in some of the antidepressants that are so successful. Well, with scarce health dollars and with a climate that is aching for us to do healthy things, we certainly can use some of these measures.
So back in 1969, about half of all kids were walking and biking to and from school on a regular basis. Today, it's less than 15%. And what's happening, school busing levels haven't really changed. What's happening instead is that parents are increasingly driving their kids to and from school. At the same time, obesity rates have soared, as you've heard today. About 1/3 of all kids today are either overweight or obese. And at the same time, kids are getting outdoors less and less. And even when you look at distance, kids who live just a quarter to a half mile to school, easy distance for walking and biking, half of them are getting driven by their parents. And so what we find is that outside schools, kids are often waiting in lines of traffic, sitting in their parents' idling car, waiting to get dropped off at school longer than it would take them to walk or bike on their own.
I've been in practice for 30 years, and during those years I've seen obesity rates triple. I've had to learn how to take care of and teach other pediatricians how to take care of adult diseases that we used to never see. We never saw type 2 diabetes, hypertension, abnormal cholesterol. I've also seen asthma rates increase. Now 1 in every 10 child has asthma, and that's due to the way we're designing our built environment and our transportation systems. As people have already mentioned, we're seeing an increased rate in attention deficit disorder, anxiety, and depression. What children need are natural places that are safe to play in. And we can either continue to medicate them and continue to, I have to look at referrals now for bariatric surgery for children. We can either continue down that path, or we are at a crossroads where we can stop them and start designing policies and built environments which promote health, not disease.
And so there's an increasing influence of more and more political organization. Pro-environmental attitudes make natural allies. There's that myth that people of color don't care about the environment. It is absolutely not true. Working with diverse partners promotes survival. It's just like think about the ecosystem and the concept of resilience. There's a parallel there. Power in the new era of community engagement. Very, very important. We're hearing a lot about outreach and community engagement. Continue to utilize that to your greatest advantage. Being persistent, developing trusting relationships in the community is of utmost importance, and taking risks in your efforts, but following through with your intentions.
Let us accept their challenge and offer a partnership and work to connect children with nature in every community. The time is now for state and federal policy action to address the indoor childhood issues. Coalitions are working together in many states. In our nation's capital, legislation, budget initiatives, and major administration actions are on the move.
Hi, I'm Enzo from Enzoology, and here's the bottom line. Kids aren't the leaders of tomorrow. We're the leaders of today.
It's so important because just sitting around watching TV all day doesn't teach you anything.
Outside is better because there are so many more things to do.
Running around having fun. Running around having fun.
Like wild things. But me and my friends need your help. We need to work together so that future generations care about and protect the earth.
When you were a kid and you went outside, it felt exhilarating. Don't you want your kids to feel the same way?